I am not a medical practitioner. I have completed doctoral and postdoctoral studies in interdisciplinary social sciences on false and highly questionable allegations of Munchausen Syndrome by proxy. I am also a qualified counsellor. Any reference to medical information on this site should not be regarded as medical advice and should not be regarded as a substitute for professional medical advice. Any medical information is purely for entertainment purposes and is for general informational purposes only. Any medical information should not be regarded as a diagnostic tool. It cannot be used to suggest, confirm, contradict, or rule out any medical diagnosis. If you need medical assistance or have medical questions, consult a qualified medical practitioner. Any reference to legal information on this channel should not be regarded as legal advice and should not be regarded as a substitute for professional legal advice. If you need legal assistance or have legal questions, consult a legal practitioner. Any risks or issues which could arise which are associated with using or acting upon the information in this video are not the channel creator's liability. I've made every effort to provide quality information on my channel. However, I do not provide any guarantees and assume no legal liability or responsibility for the accuracy, currency, or completeness of the information. If you're concerned about your safety or are suffering a crisis, contact a counsellor in your local area, such as Lifeline in Australia, 131114.
Hello everybody, my name is Dr. Helen Hayward-Brown. I'm a medical anthropologist and sociologist, and I have spent over 25 years studying false allegations of Munchausen syndrome by proxy. Today, I'm going to tell you a story. They say that to win a court case, a jury needs to be told a story, a narrative. You could call my story a morality tale, a fable, a gothic horror, or perhaps a tragedy. This is Carol's story. Her story is a compilation of many different events which have occurred to many mothers over the years. I am highlighting some of the most tragic episodes in these stories. In every instance, might I make it clear, every issue or every event which is raised in this story has been a real event, verified by me with reference to documentation and other hard evidence. The final irony for me is in relation to the history of the label Munchausen Syndrome by proxy. This label was used to make the syndrome sound dangerous, to sound scary, exotic, deceptive. The name came from von Munchausen, who had travelled widely, and he had told extensive and outlandish and perhaps deceptive tales about all of his travels. And this seemed to be an excellent metaphor for mothers who were supposedly making up stories about their children and making them sick. The final irony is this. I was told by an elderly doctor that in fact it was found later that these tales were actually quite likely to be true. He had described these peculiar animals that had never been seen before. She was happily married to Wayne, and they were both looking forward to a really happy future. They were really excited because they'd bought a new home in a beautiful garden suburb, and they were really looking forward to having children to fill all of the empty bedrooms in their new home. Carol worked really happily as a paediatric nurse, and her husband Wayne had a very demanding, high-paid executive role. They had both grown up in happy families and both always believed, as they had been taught from kindergarten, that they could trust doctors and the police and that they always had the best interests of citizens at heart. Sadly, Carol suffered 3 miscarriages in a row in their attempts to have a baby. However, they were thrilled to give birth to a male baby they called Thomas, although he was 6 weeks premature. And there were some difficulties with the birth, and a vacuum suction had been used. The AGPA scores were all right. Carol had some issues during her pregnancy, including gestational diabetes and low vitamin C and D, but they were so excited when they were able to bring Thomas home, and the doting grandparents visited regularly. At 8 weeks of age, Carol suddenly heard some funny noises from the bedroom where baby Thomas was sleeping. She rushed in and she was really worried, and she found that he was a funny blue colour and thought that he was perhaps having some apnea attacks. They rushed him to the hospital where they were given a monitor and medications to assist him. Sometimes he seemed all right and other times he didn't. At 6 months of age, he caught measles and started losing weight and vomiting. She said he started to get a rattling chest and got bronchitis. Carol started to get really worried as she'd gone off the breast when they both had measles and he didn't like the bottle. Thomas was admitted to the hospital for investigation. Carol got more and more anxious about Thomas. He developed really bad reflux. A month later, when he was a bit older, he was given a fundoplication operation. He was vomiting, had diarrhoea, and sometimes had blacking out episodes. Sometimes his language seemed to be regressing. Carol was getting really worried about this, and he was also starting to lose eye contact with her and behaving sometimes in a difficult way. She started to feel really panicky about all of this, and so she started to read up about the problems on the internet. Carol thought it might help if she saw an integrative health practitioner and perhaps a naturopath. The integrative doctor was really nice. He spent a lot of time with her. She really liked it because the waiting room, it almost had a home-like atmosphere. It wasn't so intimidating as the hospital had been, particularly the emergency departments. So she went back to this integrative doctor, and when that doctor wasn't there, she would see another doctor in that practice. They thought that together with the prescribed hospital medications and the diet that this integrative doctor had put Thomas on, and also the use of vitamins as he got older, as he was much older by now, they thought that this would help him with his problems. Carol was so worried and distracted that one day she tripped and fell over a muddy pond on the street. So the next time she went to a hospital appointment, her arm was in a sling. At the same time, Thomas had fallen over, but somehow his wound had become infected and he got really sick with a high fever. So she had to take him back to the hospital where he was put on an intravenous drip. As she was a nurse, the other nurses encouraged her to help them or even undertake some of the procedures that had to be done in relation to looking after Thomas. At the time, he was sometimes still wearing nappies. As Wayne had a high-pressure job, Carol was the person mainly by the hospital bed. And because she was no longer able to work as a paediatric nurse because she was always looking after Thomas, a friend of hers kindly set up a crowdfunding campaign to help them financially. As well as that, because Carol was stuck in the hospital all day, every day, she thought it was a good idea to post on Facebook about Thomas's progress and how they were getting on. As a paediatric nurse, she cared for Thomas carefully and got to know the nurses well, sometimes calling them by their first names. But she was lonely in the hospital ward and perhaps talked too much to the nurses, asking them questions and seeking support. Sometimes, when she was feeling very low, she would take herself off to the bathroom and have a little cry. But she always pulled herself together when she went back to see her beloved Thomas. However, the doctors seemed to be losing interest in finding out what was wrong with Thomas. They did, however, move her into a different room and closer to the nurse's station, and she thought this was good. She thought, that's good. They are actually taking it seriously because, obviously he's closer to the nurse's station if he should deteriorate. However, over time, strangely, the doctors started to be unkind to her, and they even started to be rude to her. The nurses no longer talked to her. They would be distant and almost try to avoid her. She couldn't really understand what was going on, but it was very clear that they were no longer investigating what was wrong with Thomas. She was so concerned, she went to see the hospital's patient representative. This representative was also concerned and suggested that she make a formal complaint to the hospital. Carol felt reluctant to do this, but in the end she decided it would be the best for Thomas if she did so. One day, shortly after this, a doctor she didn't know came into the room, sat her down, and spent a few hours talking to her about Thomas. Carol didn't think anything about it until the police turned up at the hospital a few hours later. She was terrified and shocked. They interrogated her into the night until about 2 a.m. in the morning. She was finally allowed to go home. But she went home alone because they had removed Thomas from her care. She had lost custody of Thomas and she was no longer allowed to see him. She had been accused of Munchausen Syndrome by proxy. So what were these allegations against Carol? They'd all happened on a Friday afternoon and she got home in the early hours of the Saturday morning. She knew she had to be in court in a few days' time, but how could she get a lawyer over the weekend? They felt desperate, but they finally found out what the charges involved by reading the police charge sheet. And on this sheet, it stated that she had been causing her own miscarriages, poisoning Thomas and withholding food, giving Thomas laxatives to cause diarrhea, suffocating Thomas, injecting bacteria into his drip and wound, exaggerating or falsifying his symptoms and her own, including reporting too many allergies and her own fracture. And she had fabricated domestic violence allegations against her former husband. She also later found out that the hospital had been making the following claims. She was bullying her current husband, Wayne, by answering all the medical questions at doctor's appointments. They said she was interacting badly with Thomas. She had bad eye contact, and so did he, and his behaviour was deteriorating. She was told that she was exploiting Thomas's illness through crowdfunding. She was accused of trying to get attention by putting photos of herself and of Thomas on Facebook. She was also told that she was over-presenting the child to hospital and that she had been doctor shopping, seeing too many doctors when it wasn't necessary. She was accused of calling the doctors and nurses by their first names. And she was also accused of visiting integrative healthcare practitioners and also naturopaths and giving Thomas an overdose of vitamins. She was a helicopter, overprotective mother, never leaving the child's bedside. Her husband was rarely at the hospital. She was often alone with her child, so she had every opportunity to harm the child. She also engaged in undertaking many of the nursing tasks. She was told that she should not have been assisting the nurses, and she was told that under no circumstances should she have undertaken any of the tasks that the hospital nurses should have been doing. She was told that she was difficult and argumentative, and she was told that she was a vexatious complainant about the hospital. I'm going to work my way through the police list of allegations and then come on to the profiling evidence. The first of these was that Carol had induced or caused her own miscarriages. Later, she found a supportive obstetrician and she was diagnosed with antiphospholipid antibodies. This is what had caused her miscarriages. Sadly, this was not the end of the story, because unfortunately, she fell accidentally pregnant. The pregnancy progressed and she went into labour. When she arrived at the hospital, she knew that she was really quite close to giving birth. They put her in the room and she waited and she waited and she waited. She tried to tell them that she was quite sure she was going to be giving birth soon. She said she was in a lot of pain and she knew from the first birth that this is how it went. She was extremely worried. They would come and have a look at her and then they would disappear. Eventually, when she was on her own, the baby started to come, and all of a sudden, panic broke out. They delivered the baby, but the baby girl was stillborn. Sadly, the obstetrician, who had not called in time to deliver the baby, said that if the baby had been born even half an hour earlier, she would have survived. Now, the next on the list is the poisoning incident. Carol found out that they believed that traces of a substance was alleged to have been injected on a specific day at the hospital. First of all, they said that she had probably injected the child in the casualty ward. But on that day, it was really, really busy. There were hundreds of people in the casualty ward of the large children's hospital. There's no way she could have done that without somebody noticing her. So then they later changed it that she had injected the child on the ward. But in the ward, she was not in her own room for a long time. She was in a 2-bedded room. And in addition to that, after she was in the 2-bedded room, she was under covert video surveillance. So it would have been very hard for her to do this without anybody seeing her. Also, she was actually not at the hospital on the day of these so-called misdemeanours. She was actually at her own medical appointments for the whole day. She was away from the hospital for a full 24 hours. Also, this alleged poisoning, apparently it was only reported verbally, the test results of this poisonous substance, but the written report said that it was negative, and a further test by a different doctor also found that it was negative. Additionally, she did not have any access to this drug. None of this drug was missing at the hospital, and they searched her home and this drug was not to be found. And what is even more worrying is the fact that multiple medical practitioners wrote multiple medical reports confirming this poisoning as if it had really happened and that there had been evidence. This was extremely prejudicial. These medical practitioners, some of whom never ever met with her or consulted with her, did not bother to go back to the original documentation to see if these allegations were actually true or not. It's hearsay based on hearsay, and I refer to this as hearsay squared. The next allegation was withholding food. Now, in the hospital records, it showed very clearly that they knew Carol had stopped breastfeeding because she had been ill, and they knew that the baby was refusing the bottle. Despite all of these feeding issues, when you looked at the medical records, the child actually lost weight in the hospital and gained weight in her care. This was simply excluded or overlooked. There was also a positive test result for protein-losing enteropathy, but this had been excluded and ignored. It was excluded from the hospital summaries about her condition. The reflux medication was found to have been overprescribed. It had actually been an overdose for quite a long time, and this had contributed to the vomiting and the diarrhoea. Not only that, when the child had the fundoplication surgery, it was later found by looking at the records that the child had been approved for this fundoplication surgery based on the wrong child's file. The child had the same name, but a different birth date and a different address. It was also found on the hospital records that rather than actually wanting the surgery, the fundoplication, and wanting to influence doctors to do this, it was noted on the files that in fact the mother had not wanted the fundoplication operation, and she had only consented to it because she said that the doctor recommended it. After the fundoplication operation, the vomiting and diarrhoea was found to be dumping syndrome. Many of the medical specialists did not pick this up. And at one point, Thomas had been on a feeding tube, and she was also accused of interfering with this feeding tube. But later, it was found that this particular brand on feeding tube had been defective, and the company had actually recalled all of those feeding tubes because they were not working properly. Now, the next one was giving laxatives and causing diarrhoea. There were never any laxatives found in her purse, at the hospital, at her home. There were no laxatives at all. The child was diagnosed with dumping syndrome, which I believe can lead to the diarrhoea. The child was overdosed on the reflux medication and actually made the reflux worse. And of course, she was diagnosed with protein-losing enteropathy, but this had been ignored. The next, suffocating Thomas. It was found that with the overdose of the reflux medication, it had contributed to breathing issues after every time that Thomas was given it. And this was actually recorded on an apnea device which had been provided by the hospital to the home. In addition, there was no evidence of any suffocation. For example, you would normally expect that there would be teeth marks from the child against the lips if pressure had been applied to the face. Now, for the big one, injecting bacteria into his drip and wound. First of all, the protocol for the testing of this bacteria was not undertaken. They should have taken samples from 2 sites, 1 peripheral. This meant that all of their results were inaccurate. The alleged bacteria that was found, Strep intermedius, according to pathology texts, can be found in many common places like hospital sinks. But the hospital doctors argued that the bacteria could only be found in contaminated water supplies such as rice paddies. But then they said it could only be found in the mouth. And they said that Carol had contaminated the line with her mouth or with dirty water. But the pathology texts show that this bacteria can also be found in the throat, the appendix, the bowel, lots of places. It also causes abscesses on the brain, and you can hardly inject the brain to get an abscess. And last of all, the pathology of the swabs that were taken from Carol showed that this bacteria did not exist in her mouth. The next one is fabrication, exaggerating the allergies and other illnesses like her fractures. First of all, the X-ray, which proved that Carol had a fractured arm, was simply never submitted to court. Many years later, family members, including Carol, were diagnosed with Ehlers-Danlos syndrome. She experienced many fractures and dislocations over the years, and these were all proven on the X-rays. This may have also accounted for the multiple allergies and sensitivities in the family. The last one, fabricating domestic violence allegations against her ex-husband. Well, this is really simple. They just didn't do their job. The police files and the AVOs against her former husband were not investigated, they were not subpoenaed, and they were not presented to court. And for all of these, when the mother was moved to a new room, she was under covert video surveillance and nothing showed up on the multiple videos undertaken. It's suspected probably that there are other genetic problems going on in this family, but the family are too afraid to follow this up because they are afraid of being accused of doctor shopping. Now let's have a look at some of what I believe are really at times nonsensical profiling of mothers. The statements made by Carol to doctors at medical appointments were erroneously attributed to her, when in fact, many times her husband had made the comments, and this was found in medical records, and it was also attested to by her husband. They lived a long way from the hospital, so it was very difficult for her husband to be there, particularly since he was working very long hours. In relation to her argumentative behaviour and the eye contact, Thomas was later diagnosed as being on the autistic spectrum, and years later, Carol herself was diagnosed as being neurodiverse and on the autistic spectrum. As for the doctor shopping and the number of doctors she had allegedly seen, the numbers here were just absolutely, completely wrong. Even though she went to the same practice, if she saw a different doctor because her doctor wasn't there, this was counted as doctor shopping. But what is even more worrying is that on the pathology request forms, where under the company name all of the pathologists were listed, and often that can be up to 10 or more as we know, these were all counted as separate doctors that she had visited. They were all added up and used against her. And when she was told that she was over-presenting to the hospital, many times that was actually hospital transfers. One hospital had transferred her to another hospital. All of the medical tests and procedures were requested by qualified medical practitioners and not due to the influence of Carol. They were clinically noted to be necessary. And it was a doctor who prescribed the vitamins for her child. She just didn't go off willy-nilly and saying, I'll give give Thomas all of these multiple vitamins. No, the diet and the vitamins were guided by a qualified medical practitioner. And as for what she was doing as a nurse, yes, they thought she had too much medical knowledge because she was a nurse. But how could she get rid of that medical knowledge? She had that medical knowledge because of her profession. She called the doctors and nurses by their first names because she was introduced to them by their first names. And as she was a nurse, she started to pick up on the medication errors. And as she was a registered nurse, that was why she had been asked by the nurses to assist them with their tasks, because they were run off their feet in the children's ward. And as for the diagnosis of Munchausen syndrome by proxy, this diagnosis was made after one 20-minute consultation with a hospital psychiatrist. In addition, this psychiatrist never ever saw Thomas, her son. I know that in fact I have put multiple allegations into this one case study. Normally, a parent would probably, in terms of those police charges, have 2 to 3, or sometimes a few more. But I have combined them together because I think it's very important to see what's happening. Now, I need to remind you also that every single event in this compilation, this study of Carol, was verified by looking at hard evidence and looking at the documentation. Every single issue, every single event that happened in Carol's story happened to a mother. It's possible there could be a few inconsistencies because I have combined a number of stories together, but I think that you would agree that there have been some major problems in relation to these issues. Some of you will be wondering what actually happened to this family after all of these events. Her son Thomas was never returned to her care. He developed serious mental health issues and developed a drug addiction. Years later, as she was quite young, Carol and Wayne had another child. They deliberately went interstate to have the child, and a baby daughter was born successfully. However, they were tracked down interstate, and a few weeks after the baby was born, she was removed from their care. A benefactor who knew that she was innocent came forward and paid for all her legal fees so that she was able to get her daughter back home very quickly. However, a few years later, this daughter was removed again. She was removed from the school after school finished without giving Carol any prior notice. She turned up to the school to pick up her daughter and was told by the principal that her daughter had been taken by child protection. However, later on, after some investigation, this daughter was once again returned to her care. And miraculously, this daughter has gone on to get herself educated, and she's now in her late teens and doing very well. However, after the second time when she was returned, whenever a stranger came to the house, she would run and hide, and Carol would find her shaking uncontrollably, her lips trembling. Financially, it was a complete disaster for the family. Carol could no longer work with children or work in nursing. Wayne simply could not cope at all. No amount of therapy helped Carol's husband, Wayne. He never worked again. At the criminal trial, Carol was found not guilty. She suffered from histrionic media coverage even though her name was not utilised because her children were still alive. Female journalists would come out of the court and they would kick off their high heels and chase Carol and her family down the street. This caused enormous distress to her. And after they'd done the chasing, I observed these journalists laughing in a gaggle.